Fall is officially here, and as the temperatures drop, your chances of catching the flu or other viruses, they go up. Dr. Diana Lev from Northridge Family Practice joins us live with what you need to know. Dr. Lev, thanks so much for being with us. First off, when does flu season start officially, and how severe is it expected to be this season?
Well, the flu season usually starts anywhere from December to February. But the idea is that you really have to get vaccines early enough that they work. They don't work on day one that you get them.
So it takes a few weeks for them to work then.
It takes 2 weeks.
Uh-huh.
Yes.
And how much can getting a flu shot make a difference in keeping you healthy?
Getting a flu shot makes a huge difference in hospitalizations and in being really sick. It doesn't take care of all flu variants. The way that the flu vaccine works is it actually gets the most active ones that we see in other countries that are causing problems, and the ones that are hospitalizing patients, the variants, and the ones that are getting people really sick to the point that they can possibly die, which we have every year, sadly. Those are the ones that we make a vaccine against.
And at what point will you know how effective this season's flu vaccine is?
Well, technically, we won't know how effective it is until after the season. Every single year, that is the gamble we take. Most of the years we get it correct, but some of the years, obviously, there's a problem about the virus mutating before it even gets here.
Doctor, who should get the flu shot and when should people get it?
Everybody at high risk is, of course, the first person who should be getting it, but technically, every person should get it. Most people don't realize that the people that pass away in hospitals aren't just unhealthy, immunocompromised the way we usually think about it. Not just the kids, not just the old people. It's actually young people who get flu while they're in college, while they're away, and they're relatively healthy. Flu kills people.
Yeah, yeah. And who specifically are those high risk people?
Uh, I still want to stay away from high risk. High risk are the most important ones, of course, to get it earlier on, but it should really be everybody else. But high risk is the same thing as it would be actually for COVID vaccine. It should be for any vaccine. High risk means that you have organ damage, that you have heart failure, diabetes, any organ issues. Immunocompromised also means young kids and older people.
hmm Doctor, if people are interested in getting the COVID vaccine, but they're under 65, what can they do about that?
First of all, there's no such thing that says you can't get it. You can get any vaccine you want. And I know that the rules change, but reality is, of course, there's going to be COVID out there. We know very well. We've had a bunch of COVID positive in our clinic. That's not anything new. It has become a little better, the the COVID virus itself, because so many people have already gotten COVID. But anybody who is at risk at all, this is the specific one that now allows by risk only, can get it. If you want it and you're technically not considered at risk, you could still get it. But the issue is going to be coverage from your insurance.
And when they say at risk, they mean at risk for being severely sick with it, correct? Not at risk of contracting it.
No, no, no. Everybody's at risk of contracting it.
hmm
I think if you have kids in daycare, you know that because everybody is getting COVID. But it's really people who are going to end up in a hospital or possibly die of it.
Yeah.
And remember, this is the highest the CDC gave this year as having the highest risk variant. We haven't had it since the swine flu of 2009.
Wow.
And if anybody remembers what that was like, it's H1N1. I still remember it.
hmm
I remember the number. And this means that you're going to have, or they're predicting that there's going to be many more people who are going to be sick and hospitalized. The average amount of people that get sick is about 8%. On high seasons, when we have a pandemic, it's about 11%.
Okay. Dr. Diana Lev, thank you so much for talking about this with us this morning. We appreciate it. Have a great day.
Thank you, too.